issues in sepsis. නොවිසඳනු ගැටලු සහ නව පිළිතුරු. Knowledge on sepsis is found to be worrisomely low. It is worrisomely low among public, and also it is low among healthcare professionals in low and middle income countries, as well as healthcare professionals from high income countries. This lack of knowledge on sepsis has resulted in significant challenges to all healthcare personnel, including that of the policymakers. The knowledge gap surrounding sepsis has manifested as an action gap in addressing this critical condition. So when there is an action gap, it reflects into delay in institution of appropriate treatment, which will end up as a poor outcome in sepsis. This has left many unresolved issues related to sepsis care, for which solutions have yet to emerge. This presentation of mine will discuss some of these emerging solutions for few of identified unresolved issues related to sepsis and sepsis care. First, let us start with unresolved issues. Unresolved issues in sepsis. I have categorized these unresolved issues, which were identified by me, into 5 broader groups. Number 1, that is unresolved issues in early recognition and diagnosis of sepsis. We all know that sepsis is a time-critical event. That means if you delay institution of appropriate therapy or appropriate managerial process on patients, it leads to poor outcome. Therefore, early recognition and timely interventions are crucial for success in sepsis care. So these are the unresolved issue in relation to early recognition and diagnosis of sepsis. Sepsis lack specific symptoms. So therefore, identification and detection of sepsis will be difficult and it need to be resolved. Patients with sepsis present with variable symptoms, which is difficult to diagnose them. On top of that, there are no specific diagnostic tests to diagnose sepsis, which will be a problem when you try to identify sepsis and institute treatment. Delayed recognition of sepsis is one of the major issues when it comes to treatment. When it happens among vulnerable populations like elderly, pregnant women, neonates, and immunosuppressed, it will be further have impact on outcome. It will lead to a negative outcome. In addition to, many groups in the society has lack of awareness on sepsis and its sequel. Also, the education opportunities regarding sepsis is also limited. All these factors need to be resolved if we were to embark on a good sepsis care program. So what are the unresolved issues in antimicrobial resistance in sepsis and sepsis care? We know antibiotic resistant flora, if they cause sepsis, the in-hospital mortality of these infections will be extremely high compared to sepsis and infections caused by antimicrobial susceptible flora. So therefore, the following issues need to be resolved when we are managing patients with antimicrobial resistance and sepsis. Worldwide, there is a tendency to increase the antimicrobial resistance rate. And that partly could be due to overuse or misuse antibiotics. So that both these issues need to be resolved quickly. In addition to that, there is no rapid diagnostics on antimicrobial resistance. So therefore, we are not in a position to identify pathogens which are multi-drug resistant and extended drug resistance causing sepsis, which will be a disadvantage for patient. There are no new antibiotics in the pipeline, which will be a big problem when we are trying to select appropriate therapy for sepsis caused by multi-drug resistant flora. Worsening the situation, there are disparities in access of appropriate antibiotics. The Apex Institute, like National Hospital of Sri Lanka, we find it's very difficulty to obtain certain antibiotics. So the effect may be doubled or tripled for other hospitals which are located far away from Colombo and which are in a lower level of hierarchy in sepsis care hospitals. So that will be a bigger problem, and we need to resolve these issues immediately. This article clearly states about the importance of equitable access to antibiotics when we are managing patients with sepsis and other pandemics. Sepsis tendency to cause multi-organ dysfunction and other complications. It has created a host of unresolved issues that significantly impact in sepsis care. So what are these unresolved issues related to organ dysfunction and long-term sequels of sepsis? So we don't have enough understanding on mechanisms causing end-organ damage in sepsis. In addition to that, we don't have any idea about heterogeneity of sepsis, and we are not looking at this heterogeneous presentation of sepsis, and we try to use same model for management of all cases of sepsis, which usually will end up in failure. In addition to that, there are no specific organ protection treatment, or at least these organ-specific treatments are not available in the country. In addition to that, there will be long-term sequels of sepsis, which we have failed to identify and failed to institute appropriate management. All these things need to be incorporated and find a resolution in order to make sepsis care a reality. Sepsis present as numerous unresolved challenges in selection of personalized care. Unresolved issues in personalized medicine of sepsis care. So when we were to find a protocol for personalized care or precision medicine, we need to have some sort of evidence to identify the patients who need personalized care. There are no validated biomarkers for this purpose. In addition to that, we lack understanding on genetic predisposition to severe sequelae of sepsis. We all know that there are certain genotypes who are liable to get severe sequels of sepsis. But for us, we don't have any understanding on this component, which need to be resolved early. Sepsis involves complex interaction with different systems of the body. Again, we lack the understanding of these interactions. There's no targeted therapy for sepsis, and all therapies available in the country are guideline-based, and therefore they do not recognize the differences in individual patients who are having sepsis. So that need to be addressed. Cost and accessibility. Even though there are specified therapies for sepsis in some countries, we are finding extremely difficult to use these specific therapeutic modalities because of cost and accessibility issues. Sepsis has created significant healthcare equity issues worldwide, that the distribution of healthcare facility in different regions, leading to widespread disparities in access of quality care. So this is a major problem. Even among Sri Lanka, different institutions will be having different abilities to manage sepsis, which needs to be resolved early. So what are these unresolved issues on disparities of sepsis care? So they can be categorized to socio-economic factors, geographic disparities, and health system factors. All these things need to be addressed very carefully in order to have a good sepsis care program. So what are the emerging solutions for these identified unresolved issues? Number one, emerging solutions for early recognition of sepsis. So we know biomarkers are helpful, but there are a whole lot of new biomarkers where you can use as diagnostic and prognostic markers of sepsis, which need to be introduced into the system. And also, new diagnostics are available, which we can use to guide treatment. Second important feature of this is machine learning and artificial intelligence. The new trends, we know there are certain sepsis diagnosis and prognosis tool based on artificial intelligence, which gives at least 6 hour prior notice on patients who are likely to develop sepsis, which will be a great thing when we consider our scenario in our country. So there are methods available for improved education and raising awareness. And on top of that, telemedicine and remote monitoring, which we can use to underscore effects caused by healthcare distribution and equity issues. So that can be effectively overcome with the solutions such as telemedicine and remote monitoring. Emerging solutions for tackling antimicrobial resistance. There are a few things. Discovery of rapid diagnostics, and at the moment, there are certain diagnostic kits available, commercial platforms available in other countries. We need to introduce it to our setting. Novel antibiotics and alternative therapies like phage therapy. We know there are a whole lot of therapies available like novel antibiotics. It need to be introduced and it has to be used under strict guidance by the microbiologist and the microbiology team in order to misuse or overuse them. Antibiotic stewardship programs specifically planned to end user requirement has to be incorporated as solutions for these unresolved issues. So what are the emergent solutions for organ dysfunction and long-term sequels? So we have to have mechanistic research to identify mechanisms of these organ failures and organ dysfunction. And have to introduce organ protective therapies, which we can use effectively to support failing organs. Enhance rehabilitation and follow-up, which again needs to be incorporated into the system to rehabilitate patients who are ending up in chronic sequels of sepsis. So here you can see this program where depends on physical rehabilitation, nutritional support, psychological support, and continuous follow-up of patients who are ending up in chronic sequels of sepsis. So this can be utilized effectively in our setting as well. So how are we going to find solutions for disparities of care? So generally, it can be achieved by improving access of care, addressing social determinants of health. We know there are certain factors which decide on provision of healthcare, and it's based on society. So we can identify them and try to rectify them in our solutions. Culturally competent care. So we know, so there are certain cultural groups or certain groups where they don't have access to better care, and we have to find a way to overcome that issues. Reducing bias. We know that there are certain biases which we use in treating patients with sepsis. So that needs to be reduced. Strengthening the follow-up care. So it's not only at the time of treatment, but we have to serially follow up the patients so that we'll be able to make a difference in sepsis care. So how are we going to improve the personalized medicine? So again, biomarker discovery and validation, which we can use to identify patients who are at a risk or who will respond to aggressive treatment. Again, we have to look into the genetic profiles of individuals who are likely to end up in complications of sepsis. And also, we have to address pharmacogenomics, where it says who are the likely group who will be benefit from certain medications, so that we have to infuse into our system and try to arrange personalized medicine. And top of that, targeted therapies. We know that certain targeted therapies instituted in certain groups. So to identify them and appropriately using it will be an emerging solution for these. So in summary, we all know that sepsis remains a formidable foe, causing significant mortality and morbidity in all over the world. It poses a multifaceted challenge for healthcare professionals, requiring organized action to improve outcomes. Understanding the vicious cycle of sepsis is crucial for early diagnosis, timely intervention, and effective management of this life-threatening condition.